a pushy broad from the Bronx, New York. Follow her voice, a straight dog is nice. She's a pushy broad from the Bronx, oh yeah. Don't be surprised if you wanna listen twice. Make decisions, find the right choice. Know yourself better, find your own voice. It's okay if you need help today, cause everybody needs a little push. From the pushy broad from the Bronx, New York.
Good afternoon and welcome, Transformation Talk Network listeners. My name is Ellen Stewart, and I am the pushy broad from the Bronx. Welcome to my show, Recovery Recharged, where we share advice and support from experts in addiction and recovery. Every single week, I get to meet phenomenal people in the recovery and addiction field, and I get to hear everything that they're doing and all the wonderful new things that are coming to this country that I need to share with the rest of the world. And this is one of these times. I am bringing to you today something that I never saw before in addiction and recovery, and I have an expert to talk to you all about it. Today's show is about treatment on the move, and we're going to talk about something called the Recovery Mobile Clinic. And they are actually mobile units that offer medical and social services on site at your location in various states and are very similar to that of a local doctor's office or urgent care. The founder and president of Recovery Mobile Clinic is with me today. Her name is Jordana Latozas. Let me tell you a little bit about her, and then she's going to tell us all about RMC, Recovery Mobile Clinic. Jordana graduated from Wayne State University. She spent the beginning of her acute care nurse practitioner career in intervention pain management. And then she transitioned from that to a non-cancer pain control, treating chronic pain as the crisis of the working American and how it increased the addiction field. So now she is the president and founder of Recovery Mobile Clinic, and she's here today to tell us all about it. The Pushy Broad welcomes Jordana. Good morning. How are you?
Good morning. I'm great. Thanks for having me today.
You're welcome. Thank you so much. So I want to start from the beginning. Tell me when RCM was founded and what was your inspiration?
Recovery Mobile Clinic was founded in February of 2020. Great timing, right? But
because everybody went into hibernation because COVID was the beginning of March 2020, right?
That's correct.
Go ahead, keep going.
However, what we started the Recovery Mobile Clinic because as a nurse practitioner in just a traditional office, we were losing about 30% of our patients to follow-up because of transportation barriers. That was unacceptable.
So what you're saying is, explain that just a little bit. When you say you were losing about 30%, people weren't coming in. What were the barriers? What was happening?
Well, when you work in an addiction medicine and you're dealing with individuals who have an opiate or an alcohol addiction problem, when they can't make it to the doctor's office to get medications to help them stay sober, that can mean one of three things: that they relapse, that they may overdose, or sometimes even die because of not being able to have a ride to a doctor's office. And that's not a state that I found is acceptable.
Okay. All right. So continue, please.
So my husband sells RVs for a living. And one day we were sitting around the kitchen table and I was lamenting about the lack of transportation and my frustrations with not being able to meet patients where they were so that we could get care to patients appropriately. And he jokingly said, well, we should put it in an RV. And I said, why don't we? Why don't we put it in an RV? We started doing some research and looking into it and realized it's not only feasible, but it's actually very, replicable. So we can not only do this in this area, but teach other people how to do what we're doing.
So how long ago did this start? You said February 2020?
2020, four
And when
years.
you first got rolling, when was that?
We were rolling in April of 2020.
Wow, that's really something. In a very short time, you were rolling in April of 2020 in an RV that's set up how? Describe it to us. And I know there's some
So
pictures on the web, but describe it.
sure. So for anybody who's ever been in a camper or an RV, we take old RVs, and again, my husband and business partner, we rebuild them. So we take out the stuff we don't need, extra refrigerators and stoves, and we put in medical grade fridges, we put in medical exam tables, and we turn it into a clinic. And then what we do is we stock it with our medical supplies and partner with community partners in the area and literally bring an office right to that facility and engage people in the community.
So where are you currently? Where did it start out? What's the geographic location?
So currently we're in Michigan. We are in Southeast Michigan, so we service a couple counties in Michigan, namely like the Detroit area, Southeast area, but we are moving into Flint, so hitting into kind of more of Central Michigan. The big picture goal is to try to, again, replicate these services so that we can actually inspire nurse practitioners like myself to do their own business, but also to really make a meaningful impact in the community by taking addiction medicine out to where the patients are.
So when you first started back in April of 2020, what kind of patients were you seeing?
At that time, it's funny that you brought that up because we were in full COVID swing, right? So what I say is when we were trying to bring a mobile addiction clinic into a municipality, the stigma against addiction is very alive and well. And what I got was a lot of resistance. I joke that people saw me as kind of the Pied Piper, that I would bring a truck into an area and kind of bring the problems with me. But when COVID problems surfaced, we just like everybody else had to pivot very, very quickly. And in Michigan, it was still cold, right? But the shelters were empty, the transitional houses were empty, people were on the streets with nowhere to go. We started to perform COVID tests with the pure intention of getting people into a shelter, right? But what that did, and you know how COVID took on a life of its own, was it showed the municipalities that we weren't the problem. Actually, we brought a very big solution, right? So we learned from that. We learned that unfortunately, because of the stigma, taking addiction head on, we creates a little bit of resistance. So we lead with a lot of our other additional services. We do hepatitis C screening and treatments. We do HIV prep. We do a lot of bridge medical services. So medication refills and primary care, tooth infections, UTIs, a lot of urgent care treatment modalities to, again, try to encourage patients to stay in their treatment program and complete it while we help them transition into a primary care setting. And using that model, we're not so much of a threat and we get a lot farther, a lot faster.
And of course, there's still the stigma and it continues, which is why you and I both do the work we do to get the word out and have people realize that it is everywhere.
Mm-hmm.
So you started this way and you're still continuing to do these services, which is really important. You went from one RV to how many now?
We have 3 units now, 2 RVs and an ambulance, and we just purchased a 4th one. So we are growing quickly.
And I know that you have a personal mission when it comes to RMC. And what is that?
Well, as a nurse practitioner, my goal is to empower other nurse practitioners, right? So nurse practitioners in our world are really at a tipping point. What we talk about is something what we call full practice authority. So nurse practitioners in 27 states are now able to own and operate their own clinics without physician oversight. That means we have so many providers that are able and willing to go out into the community and meet people where they are. So that's what Recovery Mobile Clinic is going to do, is teach nurse practitioners how to do what I did and empower them to not only own and operate their own clinics as an entrepreneur, but make such a huge community in the community, in a huge impact in the communities that they live and work in.
So if there are any nurse practitioners out there that want to get in touch with you directly and find out more about what you're talking about, how do they do that?
Our phone number is right on our website, which is www.recoverymobileclinic.com. And my phone number is right on there. My extension is 201. Please give me a phone call, because that's a huge part of this passion, is trying to teach nurse practitioners to do this. It is very feasible. It's possible. If I can do it, you can do it.
Yes, and you do. And I am confident that with your training and with your leadership, and certainly with your inspiration, that your mission of putting a recovery mobile clinic in all 48 lower states and even the 2 others will definitely become a reality, because this is much needed help for sure. So I want to talk a little bit about the recovery work for RMC, and I want you to talk about what you do in terms of medical assistant treatment, how you diagnose this, and what exactly do you do in terms of the recovery portion of this?
Absolutely. So the Recovery Mobile Clinic does keep our medicated assisted treatment to non-addictive medications. So our main push is naltrexone, which is in the form of a pill or in the form of the injectable Vivitrol. Now, there's a couple reasons why we do this. First and foremost is safety. Controlled substances can be a target for people who don't necessarily want to just get sober. So we have to, as we're taking these trucks into high risk areas, we try to keep a blanket policy on no controlled substances across the board, and that's always a safety.
For safety reasons, for safety
Right.
concerns. Sure.
The second reason is we aren't in the same place every single day. So our clinics run so that they change locations every day, but they repeat the same location every week. So our Monday schedule looks exactly the same. We're at the same place, the same time every Monday, every Tuesday, every Wednesday. So patients have that repetitive, easy to find us. But, if I drop off a 6 Suboxone scripts on Monday, on Tuesday, I could be 100 miles away, which means if something happens with those prescriptions, if a patient has a complication, I'm not there to intervene or to assess. And so that's a safety feature for the patient. So that's another reason why we do not do the controlled substances. The third reason, and the most important, is because what we're trying to do is get individuals who don't trust the healthcare system to re-engage, which means we have to be very positive, very inviting, very encouraging all the time. And when you're prescribing a controlled substance, the nature is that it takes on an accountability factor. It changes the dynamic between the provider and the patient. And it is the nature of what it is. It's a controlled substance. There comes that give and take a little bit, that trust barrier that happens. When you're dealing with non-controlled medications, that barrier doesn't occur. So even when we have patients who mess up, when they do relapse, when they have a slip and they come back, it's not a negative, it's not a negative interaction. We're not, pulling their meds back or, kind of, being dismissal or derogatory. What we're actually able to do is be extremely welcoming. It's usually like a hug from everybody in the clinic. Oh my gosh, I'm so glad you're okay. Thank goodness you came back. We're going to talk about it. We're going to go over what happened, where were you, who were you around, at what point did you know you were in trouble and you ignored it, right? We're going to talk about it, but we have to make sure that we also are giving them credit. I know you messed up, but this time you came back within a week, right? The last time it took you 6 months. So yes, it's a mess up, but it's still an improvement. You recognized it faster and you came back faster. And people need reassurance when we're dealing with a population who's always hit with the negative. It's hard to build them back up if you're just continuing to feed into the negative, you're doing it wrong mentality. And so by keeping it non-controlled, we're able to be that extremely positive and uplifting presence, because that's how we start re-engaging those people and getting them to fight for themselves again. They have to believe it first.
Well, it sounds like not, in addition to the medical attention you give them, you also give them some psychological attention as well, and some TLC that comes along with it in order to engage them, and like you said, give them the opportunity to come back to you. So you build communities, yes?
Yes. Yes. And I say that, yes, we are treating medical problems. Yes, we are treating psychological problems. But really what we're treating is a population who has lost a sense of purpose. And human beings don't do well if we don't have a reason for being, right?
And that's very well said. And I completely agree with you. And I understand you're not doing any controlled substances, because it just sets a whole different air about it. And it's a dangerous situation, and it's difficult to titrate, and for all the reasons that you mentioned. So in addition to the naltrexone, what else are you using, maybe for alcohol or for heroin addiction, that would be considered a non-controlled substance?
So it depends on the patients and at what point they are in their recovery, right? Some patients are still actively using, and in that case, we can help mitigate some symptoms. But what we really have to do is get our case management involved, and we help get them to the level of care they need to be in. Usually that's an inpatient, treatment detox program, because they need a little more close monitoring, right? Alcoholic patients, same thing, especially if they're in the older population. We have a higher risk of seizures and cardiovascular or heart attacks, arrhythmias or irregular heartbeats with a detox. So depending on the patient and the risk factors, that again may be a transition to sometimes a hospital or an inpatient treatment program to do some of that more controlled detox. But we will use medications like Zofran for nausea, phenobarbital for seizure prevention, medicines for anxiety and depression and some of the co-occurring psychological factors that are really kind of the primary factor here. So you have to address those as well. So there's a little bit more of a limitation on what we can do on an outpatient acute detox, but we can get the patients to the level where they need to be.
And just for clarification, you are not a rolling methadone clinic, correct?
No, we are not.
Okay.
And for the same reasons, right? Again, safety and the ability to really just have a positive interaction with our patients, which is what we know the patients need overall.
And in addition to the work that you're doing in addiction and recovery, you are providing other services now, considering we're at endemic stages, correct?
Yeah, absolutely. So when you're dealing with a person, you're not dealing with one thing, right? People are multi-layered. We don't live in a bubble. There's so many factors that are kind of going on. So, we have individuals that come in with uncontrolled diabetes or high blood pressure or, UTIs and tooth infections. And, there's so many other layers. And sometimes if you're dealing with somebody who has a history of an opiate addiction and a really bad tooth infection, you ever have a tooth infection? I mean, ouch. You're not going to get them sober unless we address the pain first. So we have to kind of take into account those levels. Now, what we know from an inpatient standpoint is a lot of our treatment programs, our 3-quarter houses that we go to, that's a huge part of their attrition rates. People will leave an inpatient program, which is where they need to be for their sobriety, but because they have a tooth infection they can't get addressed, or because their blood pressure is out of control, so they send them to the hospital, and the hospital gives them a morphine pill, and the next thing you know, out they go, right?
They're gone.
They're
Right.
gone. So we lose them for a treatable condition. So sometimes we're not even directly impacting their sobriety with medications aimed at that specifically, but if we can keep them in their treatment program by controlling their high blood pressure and avoiding a hospital stay, then the patient stays where they need to be, right? And the overall benefit is astronomical because they've completed that program. But also think from the mental health side, right? If we have somebody who comes into a detox program and has uncontrolled bipolar or schizophrenia, and they can't get into a psychiatrist for another month, that can create a very dangerous situation, not only for the patient, but for the other patients in the facility and the staff in the facility as well, often resulting in the patient being sent to the psych ward or sent to the ER, and again, missing out on the opportunity to get the sober counseling that they really need. So if we can bridge those services, keep them stable on their medications as we're transitioning them over to the psychiatrist, that's where we want them to be. But we understand there's not enough, right? So if we can keep them stable for a month and then get them into their next level, that psych, then the patient stays where they need to stay and they have a chance, they have a real shot at staying not only sober, but really taking their health goals to the next level because we kept them stable.
So recovery mobile clinic sometimes acts as a very effective triage to
Absolutely.
move from the beginning stages of treatment to the more acute care should they need it.
Yes.
And you're right. You not only treat the physical, it's not only the addiction itself, but all of the things that are leading up to the barriers to treat that addiction, the maintenance, and of course, the psychological aspects. So tell us again where we can find information on Recovery Mobile Clinic.
Our website is www.recoverymobileclinic.com. You can also find us on our Facebook page, our LinkedIn page, I'm bad at this, TikTok. I am on TikTok.
Okay.
And what's the other one? Instagram.
Okay. All right. Recovery Mobile Clinic. And we're going to talk a lot more about this in a few minutes. I think we're going to take a short break so we can talk a little bit about how, again, this got started and why it is personal to the president and founder. When we come back, stay with us. We're back. This is Ellen Stewart, the pushy broad from the Bronx. Welcome back to my show, Recovery Recharged. I am talking with the very lovely Jordana Latozas, and we're talking about the Recovery Mobile Clinic, which right now has mobile service in Detroit, helping people not only get clean and sober, but also through her clinic, helping with a variety of mental problems that she can help treat. And we're going to talk a little bit more about her specifically. And what I want to know is, how did you get involved with this? What made you decide for yourself that this is what you wanted to do? Give us a little bit of information about you.
Well, nobody goes into nursing school really knowing what they want to do with the rest of their life. So when I started nursing in the ICU, I was always drawn to the individuals that I would see there that had taken their addiction to this extreme level that landed them in an intensive care situation. Why was I drawn to that? Because my family struggles with alcoholism. So I've had experience dealing with individuals that they just struggled, and it caused difficulties within their personal life, within their job. And it always made me question, what made me different? Why could I have a drink or two, put it down and walk away, but so many close members of my family could not do that? And it turned into a problem that robs them a lot of their potential. And it crossed over into my professional life when I started seeing patients struggling with the same thing. Now, my nurse practitioner training in my master's I graduated in 2010, and my first job was in an interventional pain management clinic. Now, if you do the math a little bit, 2010 was kind of right before the opiate crisis hit. At that point, we were still being told that pain is the fifth vital sign, that chronic pain is the curse of the working man, that OxyContin and Opana and even fentanyl suckers, if you remember those, were non-addictive and a solution, not a problem. Now we all know what happened later. We all know that, the research finally came out that we did have highly addictive studies. And so as a professional that was working in a field that I feel contributed, we can hide behind ignorance at the time. We can hide behind the fact that I was a pretty inexperienced provider at that time, or that was the research that was being told to us. That was the information we had. But however we got into this mess, the fact of the matter is that the healthcare organizations need to take accountability and offer solutions to the patients who are suffering as a result. And that is what the Recovery Mobile Clinic is doing. We're trying to address the needs of the population that is struggling as a result of the opiate crisis and offer some real life access and real cures that meets the need.
Do you sometimes provide an education to your patients? Do you do some explaining as well?
Absolutely. Education is a huge part of what we do because nurses and docs can prescribe medications, we can give you the treatment, but until the patient really understands the why, until people understand what they need to do and what their actions are going to do for them, then they're not internalizing it. Just like somebody who's running their own podcast show, right? Unless you understand the ins and the outs of what you're doing, the rigmarole or the bureaucracy or the steps to put in place don't necessarily make sense unless you understand the reason you're doing it. So the same goes with healthcare. Education is essential to making the patient a key player in their own healthcare.
It sounds like you really love what you do.
I do.
And it also sounds like getting out into the community was something that you felt you must do, like a calling, would you say?
Yes. This is where nurses thrive, right? Nurses are really good with education. We love to be with patients. And nursing is, in and of itself, a holistic field, which means we don't treat a disease. I don't treat addiction. I treat a person who is struggling with addiction. Does that make sense? Which means
Absolutely.
my focus is on the whole person, not just the disease. And that is what makes nursing a little different from traditional medicine models. Medicine models are what we want. We want them to be able to treat the disease or do the surgery or, do the high level, acute level function that we need them to do. But nurses look at the whole person and really kind of pull it together from not only the community standpoint or the physical standpoint or the spiritual standpoint, the mental standpoint, because there's so many layers that contribute to the suffering that's occurring at that time.
So give us an idea of who comes in to see you. Do they come from poor neighborhoods or, low economic status? Do they come from different economic backgrounds? Who comes to see you?
Anybody who's struggling can come and see us. Addiction is not picky. It doesn't pick just people who are uneducated or who are low income or who are very high income or very high educated. It attaches itself to all of us at some level. Everybody is affected by the crisis that's going on right now. We all either personally or know somebody or have an immediate family member who is struggling that is affecting us all. I firmly believe that every person struggles from some sort of an addiction. Mine is arguably work. I am a workaholic, or coffee. But all of us struggle with something. Now, whether or not it's socially acceptable or as detrimental is up for debate. But there's, I think, a big part of why people do not seek help is because of the stigma that's associated with mental health and addiction. And it is very sad when you think of this as mental health and addiction are the only two disease processes where we're more scared of asking for help than we are scared of the disease itself. And even if the disease is going to kill us, we know that the addiction may result in our death, yet that scares us less than talking about it with our friends and family members. And that's backwards, and that has to change.
It is. And it's people like you that one mobile unit at a time will try to tear down that stigma. And that's exactly the benefit of my show, Recovery Recharged, and the wonderful Recovery and Addiction channel that's coming to the Transformation Network, which is why we are trying to do this in one big movement to tear down the stigma with people like Jordana and the Recovery Mobile Clinic. So tell me, if all walks of life come to see you, how are you funded?
So we bill insurance just like any other doctor's office. Okay. So we take all forms of insurance. Now remember, we're just in Michigan. So as we expand to other states, we'll do the same thing. But we do not ever turn anybody away for not having insurance or for an inability to pay. We are a 501c3 nonprofit organization. So what that means is we take donations, we do fundraising events, and all of our funding goes towards what we call our patient recovery fund, which for all intensive purposes is like the Recovery Mobile Clinic's insurance company. So if I have a patient come in that does not have insurance, we treat them exactly the same way. They get exactly the same services. And what we do is apply that patient recovery fund money to their care. And in that way, that patient's services get covered. Now, we don't stop there. That's where our case management team kicks in, and we actually help them get an ID or a social security card or get their Medicaid application paperwork returned in so that they can take, again, those next steps and continue their journey to health. And sometimes that includes just getting the paperwork under.
I hope you're listening to this, America, because these are the steps of angels like Jordana, because what we're talking about here is she's accepting insurance. They take all forms of insurance, and as she said, they will not turn someone away. And in order to do that, they need donations, they need help, which they put into a special fund. So where can we donate? Let us know again, please.
So on our website, www.recoverymobileclinic.com, we have a direct link for donations. And remember that 100% of donations goes directly to patient care. So that money will sit there waiting for that next patient to come in. And when they do, that money goes directly to paying for that next person's visit.
That's amazing. So I know you also mentioned to me before that you had partners in recovery. Could you tell us a little bit about that?
Sure, we have lots of partners in recovery. The Recovery Mobile Clinic, our whole mission is to try to make, addiction accessible. And you can't do that alone. I can't do everything, right? And healthcare as a whole doesn't communicate enough. And what we're trying to do is bridge those gaps. So we partner with our community organizations like the Salvation Army or like the local shelters, the local food banks, transitional houses. And what we're trying to do is keep those patients stable and engaged and assist them into those next levels. So that next level is partnerships with primary care docs and psychiatrists and, social workers and the individuals that may help continue to guide these patients through their health journey.
So when we say partner, what do we actually mean? Do we actually make appointments to see people? How do they serve you? How do these partners serve you?
So we work in an RV, right? We can't just pull an RV into a Walmart parking lot and set up shop and say, "Hey, we're here today." It doesn't work that way. So
Right.
we build out what we call memorandums of understanding. So they're agreements that they allow me to be on their sites, and they have their services, we have our services. Kind of the legalized agreements that we can be there so that our unit can be on their property offering services. And then, like I said, we have a schedule that changes every day, but it's the same every single week. So when I have a partnership with the Salvation Army Harbor Light in Monroe, I'm there every single Tuesday at the same time, same place. So their staff can depend on us, right? And so that's the key piece, is being reliable and dependable, even in a mobile model, because that's what people need in order to trust that you're going to be there for them.
So if you wanted to send a message to any potential partners out there that may also be in your area in Michigan and surrounding areas, what would you want them to know about you, and why should they partner with you?
The Recovery Mobile Clinic is going to add value to their service. The additional services that they might not be able to add personally, but we can, so that they can, for one, be more successful at recognizing patients' needs. For two, keep patients from leaving their facility before their treatment program has been completed. So they have a higher completion rate because we're meeting their medical needs where they need to. And then for three, they have a much improved score by the patients, because the patients are feeling like they've actually been heard. Their concerns are being met. Their concerns about their health and their blood pressure, their mental health isn't being pushed off until later after you complete treatment, almost as a secondary thought process. It's actually being included as part of the whole part of healing, which is important to understand.
So if anybody is interested out there in being a partner with Recovery Mobile Clinic, then again, I'm sure they can go to your website, recoverymobileclinic.com, right? recoverymobileclinic.com. Investigate, call Jordana directly, become a partner, and have them continue to have an additional fleet of RVs to go out there and serve the community, right?
Correct. You got it.
All right. So now I want to hear some of your success stories. Give me some of your favorite patients, where they started and where they ended up with your care.
Fantastic. One of my favorite patients to talk about was a gentleman that came and saw us at a shelter in Detroit. And let me just say that when he showed up, he was mean and angry.
He was like the Grinch.
Oh yes, just kind of he didn't want to be in the RV. He didn't want to talk to us, but he was sent out there because his blood pressure was very high. Now, as we were kind of talking with him and figuring out what was going on, it turned out that he was stuck. He had been released from jail a couple months before. His ID was stolen on the bus, so he had no ID, no photo identification, no social security card, no nothing. He had felt like there was no way to get out of this shelter, and he didn't know what to do, and the stress level was driving his blood pressure through the roof. So we addressed his blood pressure, but what we also did was got him tied up with our case management. And the first step was we got him on a government cell phone so that he had a communication. Then our case manager was able to get him an appointment for an ID, and that was done. And then she got him a social security card, copy of his birth certificate, the paperwork, the silly stuff, but it's the paperwork that has to get in place, right? Within 2 months, he had a job. Within 4 months, he was out of the shelter and in an apartment with a car. And he came back, and guess what? No more blood pressure meds, right? Because really the issue wasn't hypertension. The issue was the extreme life stress that he just couldn't see his way out of. And he came back in and said, you were the first people that actually saw and listened to what my problem really was. It wasn't my blood pressure. You saw that my blood pressure was high because of what was going on, and my life changed when I walked into an RV, and I never would have thought that that would have been possible.
And in only 4 months' time, that's absolutely remarkable. And I assume this was not a young man.
No, he was in his 50s. So
Okay, so a middle-aged man,
yes.
relatively young. All right, another story, please.
So another one, now this gentleman, he still sees us, so he's still on active Vivitrol treatment. So he's actually been sober now from alcohol for about 6 months, and we actually got him cured from his hepatitis C, which was a huge win for him. He told us over and over again that the reason he never quit drinking was because he figured he was dead anyway, because he couldn't get his hepatitis C cleared. That's not why I'm telling the story. I actually have another quote, I promise. So he's come a long way, and he's just a funny guy. He's a happy guy to be around. So we asked him, would you mind writing a testimonial, just a way to kind of say thank you, something that we are going to publish on our website. And he knows that we have ideas to become national. So this is something that is going to be seen all over, and he knew this. I obviously did not publish this on my website, but I used this as a good example. He wrote this very nice letter saying how wonderful we were and how great that we paid attention to him, because we were the only people that listened to throwaway people like himself.
Oh my goodness, he described himself as a throwaway person.
Correct.
That's
After
really
being sober
profound.
for 6 months. You would never describe yourself like that.
No, I wouldn't, but I'm the pushy broad, and many other people would.
But that mindset is what's going to keep him down. So even though he's 6 months sober and his life has completely changed from what we saw at the beginning, he is not that far away from going right back, because the mindset of him being a worthless person is still very much alive. And that's part of the stigma. And that's why it is so important that we tackle this head on, because a person with a problem is not a worthless person. A person with a problem is somebody that is worth being invested in. And that's the message that has to come across.
That's absolutely wonderful. So, what is your big picture for RMZ? Where do you see this heading, and when do you see this happening?
So Recovery Mobile Clinic is in a huge growth jump. What we are actively pursuing is a chapter model. So what we're trying to do is teach nurse practitioners to do what we've done and to establish chapters all over, I say, the lower 48. As soon as I get an RMC unit in each lower 48, I feel like I can pass the buck on and go retire. But the goal is not only to increase access and increase awareness and decrease the stigma, but really make nurse practitioners the forefront of community health and change the way that we're combating addiction in the United States by taking it out to where the people need it the most.
So tell us again how nurse practitioners can get involved in this now because of the new laws. Explain that again.
Yes, sure. So nurse practitioners are going up for what we call full practice authority, which means that we no longer have to work directly underneath a doctor. So we can own our own clinics and run our own practices. So that's opening up this huge niche of healthcare providers that can help people. Now, nurses, like I said, do the best when we're with people out in the community. That's where nurses shine. We always have. So this model gives nurses a perfect way to put their entrepreneurship to work, to engage the patients that everybody else is looking over, pick them back up and close the healthcare model holes, and not be a threat to the current systems that are already there. Actually, feed them, right? We're picking the patients up and then transitioning them over. So it's a perfect spot for nurse practitioners to really find their niche and make community medicine the way of the nurse again, the way that it should be.
So why do you think that the recovery mobile clinic model that you're using is so successful compared to other community models?
The key to the recovery mobile clinic is the fact that the mobile model is all we do. Most other mobile clinics are tied to some other type of organization, a hospital, a primary care clinic, a mental health clinic. So their focus is always going to be their primary building, their brick and mortar. The mobile clinic is like a secondary or a volunteer run program, which means as soon as there's funding difficulties or staffing issues, that's always the first thing to get shut down, which means it's not reliable. People are people. People are creatures of habit. We need reliability, right? If a program is gonna, or a facility is gonna invite a program in, they want a program that's going to be reliable and consistent, right? If a patient is going to go see a provider, they want somebody that they know is going to be there when they say they're going to be there, right? Or that the services are going to be the same. That's where the recovery mobile clinic shines, because that is our main focus. We don't run on volunteers. We have fully staffed, fully paid, fully benefited employees. So this is our 100% focus, which means we are going to be more successful because we put 100% of our efforts into the mobile model.
So you're not dependent upon a hospital and hospital expenses and hospital budgets, but if a patient needs hospital care, you would arrange an ambulance to a hospital or a treatment center. You would arrange that transportation to the next higher level of care.
Correct.
And for all of you nurse practitioners out there, what a wonderful way to establish a business on your own. And all you have to do is get in touch with Jordana at recoverymobileclinic.com, and she will show you the model for Recovery Mobile Clinic. I can't think of a better way to get out into the community and help people. And I would be thrilled to see a Recovery Mobile Clinic in all 48 states, especially with you at the helm. It's a wonderful thing. So tell us again how we can help.
So a great way I always say to help is by sharing the story, right? Tell people about the Recovery Mobile Clinic and everything that you heard about today, because knowledge is power, and it always is going to help our main goal, which is ending the stigma. So share this podcast, find us on LinkedIn and share our posts, like us on Facebook, follow us on TikTok. All of those kind of things help increase awareness and really push our mission out there, which is increasing access to healthcare.
So tell us a little bit about the people that you work with every day. When you say employees, who's in the RV, who's driving the bus, what's going on? Tell us about it.
All of our staff are driving. So we train all of our staff to drive RVs. We're a team of nurse practitioners, PAs, paramedics, medical assistants, social workers, peer recovery coaches, and then we have the office staff. We have, accountants and lawyers, and my husband, who's the chief operating officer, aka RV expert. So, the mechanical side of it. So it's a huge conglomerate of team members, but we are very proud to say that 40% of our team is actually in active recovery themselves, and they are our best team members. Because not only do they believe in this wholeheartedly, and this is a passion, but they see themselves in the patients, and they are the most compassionate and the most impactful when they're talking on a patient-to-patient basis.
I would say that's just about the number of people that work in recovery. At least 40 to 50% of people that work in recovery, like myself, are people in recovery. So I understand that. Okay. So you have any final messages for us here at the Recovery Recharge Network? What do you want us to know?
My final message
Go ahead.
is always, I'm always wanting to leave everybody with a message that my slogan, every day is a great day to save a life, and everybody can be impactful in this. Again, sharing, ending the stigma, helping volunteer with a Narcan training. There's so much work to be done, that everybody can play a role in ending the stigma, and you can't believe how much that will impact the people around you and in your community. So do what you can, share what you can, but you can be part of the solution.
And one more thing, I want to just reference what's on your website. It's kind of a mission here, 3 words that are very impactful. Tell me why you've developed them and used them. Redeem, motivate, commit. Tell us about that.
Redeem, motivate, commit is a call to the patients that you can redeem yourself. You can impact your daily life to be motivated to be different than yesterday. And you can commit to the change that you want to see in your life. Redeem, motivate your future, and commit to what you want to do.
Absolutely outstanding. Jordana Latozas Recovery Mobile Clinic. You are in Detroit, right? And the surrounding areas. Give us the counties again where you are in Detroit.
Wayne County, Oakland County, Macomb County, Monroe County, Ingham County, and soon to be Genesee.
And there are how many mobile units out there right now?
3, soon to be 4.
3 mobile units, soon to be 4, for recovery, for addiction work, for medical assisted treatment, for blood pressure testing, for COVID-19 testing, for all of the things that you want to go see a doctor for. They will help you. They will be there. They're doing fabulous work. When you want to donate, please go to recoverymobileclinic.com and give. Jordana Latozas, thank you so much for being with us. I really appreciate you coming here today.
Thank you.
This is Ellen Stewart, the pushy broad from the Bronx, saying thanks for listening. And remember, everybody needs a little push.
From the pushy broad from the Bronx, New York.